Good afternoon and welcome to Webinar Wednesday. Today we are joined by Mike Wade, VP of Sales at PartSource. Webinar Wednesday would like to thank our sponsor PartSource. With the mission of ensuring healthcare is always on, PartSource empowers owners and operators of mission critical equipment to maximize clinical availability and patient throughput while achieving substantial savings and efficiencies. PartSource connects more than 5,000 hospitals and 15,000 clinical sites with more than 10,000 suppliers, enabling access to parts, services and training through a leading technology platform for managing mission-critical healthcare equipment. The PartSource enterprise software platform, PartSource Pro, enables 1,600 leading hospitals across the country to solve a shared set of challenges and maximize asset uptime, reduce costs, and increase procurement efficiency related to equipment maintenance. So for more information, please visit partsource.com. Now, just a reminder about our Spring MD Expo, which will be held at the Pechanga Resort Casino in Temecula, California, April the 15th to the 17th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more information and registration details, please visit mdexposhow.com. We have a milestone to celebrate here at TechNation. We turned 15 this year, and who better to celebrate with than our readers? Now, TechNation invites readers old and new to help celebrate its anniversary with 15 prizes and a monthly time capsule in the magazine. So for more information and your chance to win, please visit onetechnation.com/contest. As usual, today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. Now, if you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's webinar by giving away a Swiss Force Miced Up multi-tool to the attendee that can tell me the answer to the following trivia question. February is American Heart Month. What color is everyone encouraged to wear during this month? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on your webinar dashboard. As I mentioned earlier, our presenter today is Mike Wade. So Mike, you may begin whenever you're ready.
Wonderful, thank you. And thank you for the opportunity to present in this forum. This is something in a partnership that we've sincerely appreciated over the past year, so appreciate that. We'll get started. What I wanted to talk to the group today about was HTM solutions to transform mission critical operations and improve clinical availability. This is really part of the blood of what PartSource began with, and where we've been able to transform this over the past 20 plus years. So today's agenda, we wanted to go through, discuss some of the key challenges that hospital systems are facing, provide some insights from a report that we recently did, which is the state of the HTM, and share some of our views and how we support procurements, how we support HTM teams, and just our take on what this report means and how we're able to support the teams also. Lastly, talking about the workforce. We partnered with RSTI, and we've tried to really combat some of the challenges that we're seeing in this space right now through some unique programs. So wanted to go through that as well. So let's get into it. First of all, my name is Mike Wade. Just a small background on myself. I started with PartSource in 2002. This was my first job out of college, and I think I was employee number 16. Fast forward to 2025, we're just about to eclipse the 500 employee mark. The company has grown significantly during that time. I spent a small bit of time away from PartSource. I like to think of it as I left home for a couple of years. I got to go and work for General Electric, and I spent some time with the great people at All Parts, Dunley, and Phillips, and then back home to PartSource. But my entire career has been spent serving this community, and there's not a whole lot of places that We can serve these types of people with the mission goal of making sure that patient safety, our local hospitals, our regional hospitals, our national hospitals are supported with the equipment that they need. So let's get into PartSource a little bit. First of all, who is PartSource? When we began the company in 2001, it was a parts procurement tool, really. But as we've transitioned as an organization, we've really became the leading technology platform to manage mission critical equipment. It's a platform that people have used from small community hospitals to national IDNs and really everything in between. We're really proud of some of the numbers that we're able to support. Over 130 IDNs, 100,000 assets under contract management. And those contract managements assets really require over 850,000 service events. So the numbers are overwhelming, and I think we've built the right tool, the right platform, the right technology to be able to properly manage all of those. We consolidate over 10,000 suppliers, and we make those available to our customers, again, from really complex IDNs to our community hospitals, children's hospitals, academics. There's an opportunity to improve operations amongst all these organizations, and we're extremely fortunate to be able to participate in that. A little bit further about the clientele that we support. The list here is impressive, and this includes academics, this includes IDNs, this includes, again, like some of the very complex national type of clients that from a healthcare support and a supply chain perspective, these are challenging operations to run. We're proud of some of the outcomes that we're serving these customers, though. 15 to 20% cost reduction. Labor efficiency is improved. The quality performance allows for increased uptime in your supply chain and your assets. All of these things equal just a great recipe for clients, and over the past years, as you saw from the previous slide, it's been very well adopted in the market. One last slide about some of the great things that we're doing. We moved to a new office, started a new headquarters at the end of 2024. And really over the past 15 years, there's been a great effort to make sure that the culture within our organization is best in class. And it's driven from the top down. Our CEO is one of the most unique people that I've been able to work with in my career. And he's somebody that listens and somebody that really instills the ability for us to make those cultural changes and be where we want to be as an organization. I don't want to really miss this either. So ISO 1345 was really a unique thing going back 15 years ago. I think the standard now is that if you're not dealing with an ISO 1345 organization, that's going to create a challenge for you somewhere along your supply chain. So extremely proud of that accomplishment as well. Towards the end of last year, we created an HTM State of the Union report, and we targeted select customers and people who were purchasing from us, people who were not purchasing from us, to understand what are some of the challenges that these clients are facing. And it was really, it wasn't anything surprising that I think this team would see. But you know, I think when you bring these all to light, it creates the perfect storm for requiring the best partner you can find. 2/3 of the hospitals are expecting supply chain costs to grow. 20% are expecting to have an increase in labor due to labor constraints in the market. 15% of the hospitals that we surveyed were expecting to perform below what they would think of as a healthy margin. And when we think of healthy margins for hospitals, we think of low single digits. So these people are expecting to essentially perform in the red, which is not a good place for a hospital to be. And lastly, more than 50% of the customers were expecting to have to maintain extended life cycles of assets. So they're not getting budgets for replacing equipment. They're having to make do with what they have. And that, again, creates quite a challenge amongst the hospitals in the US. So some of the key challenges that really trickle down from that HTM report, limited part availability. We see post 2020 volumes that have really not leveled out from back orders and lead times, and just people are waiting longer and longer for parts. That hasn't really leveled out as much as we would have liked from post 2020. That creates a big challenge. Inefficient procurement processes at hospitals. If you think about those large type of organizations or even the small ones, a large IDN that's acquiring hospitals across the country, they're picking up a new facility that has different processes, different procedures, and that is a recipe for disaster. So being able to have a partner that has the ability to help that process out and help create a repeatable process that you can duplicate over and over again, it's a good place to be again. So one of the examples that we saw was a customer spending 20 hours to source a part that cost $25,000. Now, the cost versus reward there is probably not going to meet up. And you can spend a lot of hours trying to save dollars, but I think ultimately the concern exists of where are you buying this part from? Does the risk of where you're getting that part from outweigh the reward of potential cost savings there? So lastly is labor shortage. This was a big topic as well, and this is something that customers called out specifically. When you look at the biomed field right now, BMETs over the age of 60 represents 1/4 of the market right now. That's, we want people to retire and we expect people to retire. The challenge is, how do you backfill these people? And the average job posting for a BMET right now is 2 to 6 months. And that's somebody that you're hiring that has experience. If you're going to somebody without experience, you can wait up to 10 months. And then you can expect another 12 months to be able to have that individual properly trained, caught up to speed, and really ready to start walking and getting in front of equipment. So time is extremely meaningful there. And when you're looking at hiring somebody in 10 months and then another 12 months to train them, you're looking at almost 2 years to be able to have somebody that is properly working and working at the top of their license within the hospital. Keep moving along here. I think with challenges come opportunity, and the opportunity that we've seen within this report and what teams are telling us is the way to combat this is to bring specific repairs in-house. Let's keep these teams working at the top of their license. Let's utilize the labor of the in-house teams to be able to have more access to their teams working on equipment. Now, there's some challenges that go along with that. How do you properly train people to do this? How do you properly have the parts network in place? How do you have backup support for training? So there's a lot of question that goes into that, but really overwhelmingly, that was one of the top goals that teams, in-house teams have heading into 2025. The second was standardizing processes in order to create efficiency. I talked a little bit about those IDNs and those national organizations that are acquiring hospitals and then rolling in a separate process. That exists as well within community hospitals. That exists as well within regional hospitals. The ability to take an old process and churn the inefficiency out of it and gain time back on your side, which time equals dollars, is super impactful. And that's one of the things that our teams have proven to be extremely effective with. The last, number 3 here, was simply reducing operating costs. Hospitals, IDNs, third-party companies all need cost savings right now. And the ability to reduce those operating costs through hard cost savings make a significant difference in the hospital budget and the ability to have a profit. So 3 challenges that called out in this report. Number 1 was labor shortage. And again, we just talked about 24 months almost to bring somebody up to speed. That's creating a significant challenge within hospitals. hospitals. Access to training, although it's last, that really equates to how can I get somebody up and running? How do I allocate the dollars from a budgetary perspective to get the right training? And then how do I get that person taken out of the hospital setting for 2 weeks while they're getting training? That's a big problem for hospitals right now. The middle here was influencing internal stakeholders. And I think really what that means is championing for in-house teams, championing for HTM teams to be able to prove value, to be able to have more access to taking items off contract, to be able to have access to training budget dollars, to be able to have access to all these things that hospital in-house teams need and HTM teams need to be effective. So I'd like to talk a little bit about our take on this. What's our solution? How do we combat that as an organization and as a company? And first, the way that we do this is in a broad approach. We've built an online catalog that provides over 3 million parts in one single application. So the ability to have everything at hand creates a significant value for teams abroad and allows them to not only have access to the parts, but the data. Data is extremely powerful, and as a data-driven company, we like to be able to share that back with you. It's your data. So being able to look at prior spend, having access to RMAs, having access to quantities that you purchased before so you can forward plan those. Having the ability to know that you're working with a supplier that has built in their online catalog the ability to predict an item that will be on site. If something is on back order, we call that out. If something is available, we say you can buy with confidence. And really the goal here is to have you avoid delays, increase equipment uptime. Secondly, the operational efficiency. The streamlined purchase through a single online marketplace takes away what we see between 15 to 20 purchases from different suppliers per day, per technician. You add that up over the course of a week, over the course of a month, over the course of a quarter, and it drives a lot of inefficiency by having to go to all these different places, manage the purchase, manage the invoice, manage the return. It creates a bunch of headache for our clients, and we're happy that we can create that unique catalog to help with that. We're an evidence-based organization, and what does that mean? For every part that we sell, there's a lot of data collected around that. Think about the price point, the part number, were there alternate options available? Did the part receive on time? Did it fail under warranty? Was it returned? All of these types of quantitative data points we're able to collect. And what we're able to do is in the background run algorithm that presents you with the best choice. What's going to be the best opportunity that's going to show up on time, that's going to work, and that will be at a valuable price. And from 2011 on, you can see our quality rates have improved, which means the reduction of returns due to quality related parts. So we're right in line with best in class for what you would think of a partner to be. So really proud of the work our team's done. I think it's a question that people should ask their suppliers do you have a team that is dedicated fully to quality? Do you have a team that is dedicated fully to maintaining that ISO 13485 compliance? And if the answer is no, there's some risk there. All right, let's keep going. So driving meaningful efficiency means a lot of different things to a lot of different types of organizations. But I think really no matter what type of organization you're looking at, there is opportunity to drive out time. And we stopwatch different people such as regional healthcares, large national, and even large ISOs. And the time sensitivity here is meaningful. The time reduction is meaningful. The ability to take a process that was 70 minutes and take it down to 15 minutes, that is meaningful time. That that is per part, that is per transaction, and you multiply that again by the day, by the week, by the quarter, and it adds up to time back in your day, and it adds back to efficiency and being able to have people work at the top of their license. We're really proud of some of these customers that we work with, but I think it's really good to call out some specifics here. We worked with the Mayo Clinic, and again, using a stopwatch, we're able to save that team 85 minutes per day per technician in efficiency. So think about that as time that the technician has back in their day to be in front of clinicians, to be in front of assets, to be doing the things that they are at the top of their license to, which is fixing assets. Clinical capacity here is a big deal for people like Dartmouth Hitchcock. So when you look at the quality of an organization that you're choosing to partner with, the first time fix really is a big deal. How many times do I have to return a part? Every time I return a part, it impedes my ability to have a first time fix. It delays my ability to have that equipment up and running and ready for that next patient. So really happy with the outcomes of people like Dartmouth Hitchcock. Again, those types of academic hospitals and clients are heavily focused on quality, and this is one of the areas where we shine as well. Lastly is simply, again, this is hard cost savings. This is what people really would like to see. This is what people are needing to be able to turn a profit, get out of the red, and start to have those single-digit profit margins. And we're able to save about 23% from groups like LifeBridge Health, and support their in-house teams with being able to have those parts accessible at time of need, delivered when they expect them to be. So one of our value props that we provide to the market is expert support and customer service. We have dedicated teams that focus on both biomed and imaging. And the rationale there is we want somebody that knows the biomed world very well when they're talking to your biomed teams. We want someone that knows the imaging world extremely well when they're working with an imaging technician. And the difference here also is understanding the processes that go into both of those types of categories, understanding the challenges that people face of a biomed part versus an imaging part, and how we can operate, how we can fulfill those orders better, how we can work with your teams a bit more effectively. And lastly, it comes to procurement assistance here. Our ability to provide post-purchase support, provide recommendations, product placement is a valuable asset that we are really proud to support our teams with. We're a proactive team as well. So we have promotional products, we have new products, we have opportunities to save on what you've been purchasing previously. We like to make recommendations on maybe an alternate product that could save dollars, but not at the cost of reducing quality. So these are the types of proactive things that our teams are doing right now in the market, and really, I think, set us aside as well. Let's keep going. Workforce development and loyalty program. So to help combat the workforce challenge that we're seeing right now, we looked in the market and we chose RSTI as a partner. RSTI provides best-in-class training and really helped us to provide additional value to our customers by having that type of a relationship with RSTI. We'll talk a little bit about this, but when we choose somebody like RSTI, we like to be able to say there's a reward for being a partner of PartSource, and that reward comes through the form of training and the ability to continue education with those in-house teams, and the ability to have new assets taken off of contract that you might not have been able to have access to before because of that type of a partnership. So the concept is simple here. It's an imaging rewards program. It's designed to reward customer loyalty and support that imaging parts procurement process. And it's really exclusive to the PartSource customer. it's a value that we provide that we think is unique, and also given the ability of RSTI and their history and their legacy, we think is a pretty significant value. So I want to take just a couple minutes and talk a little bit further about that. We launched a program in 2025, which is an imaging rewards program. The goal here is to support that workforce gap that hospitals are seeing and that have been identified by HTM leaders. The concept here is earning $2,000 RSTI tuition credits with every purchasing milestone. So it's trackable from $1. We don't have a cap on this. This is something that we're really proud to offer to our clients. And there's been hospitals that have taken advantage of this and earning 5, 6, 7 credits per year. So it's something that is extremely meaningful to our clients. And again, opportunity-wise here, this is an opportunity for us to be able to support that HTM group and provide training back from what we see as a pretty major gap in the current marketplace. So I would say if there's interest in this program, we'll get to some contact information, but reach out to our teams, talk through what your needs are. We'd be more than willing to discuss further and would appreciate the opportunity to do that. So I'm going to end with a thank you very much. There's a QR code on here that you can see to download the full reports. But again, thank you for taking the time. Thank you for the opportunity. And I think we would open up to questions.
Perfect. Thanks, Mike. Yeah, we've got a few that have come in. The first one is, how does your imaging support extend beyond just parts? I mean, what services should customers be aware of?
Well, you know, it's an interesting, first of all, I appreciate the question. The question comes up when we're selling a part, are we able to provide installation as well? And the answer is yes. We do provide installation. We do provide on-demand service. We do provide technical support. So we can simply transact on a part. If you call and you need a part, we can provide that part. But if you need help with assistance in installation, if you need troubleshooting to make sure that you're ordering the right part, we're there to help as well. So I think we go above and beyond our parts when our clients need that.
Okay, so how does your customer service approach different from other solutions in the market?
A good question. I think one of the biggest differentiators that we have is we have an average of 12 years of tenure on the team. So we have people that have been with the business for over 20 years, and we have some great people that we've hired that are newer to the organization and coming up to speed very, very quickly. So I think that's a really great differentiator. When we talk about the ability to help with parts ID, to help with technical support, those resources are in place, and those people have had those conversations for years and years and years. So we have a good sense of how to leverage that and utilize the tenure that we have. I don't think dedicated service, I don't think dedicated like modalities is unique to PartSource. But again, I think the ability to have somebody like RSTI to be the backstop for our customer support team is quite a differentiator. If the parts ID goes above a certain limit, we have access to the best training in the industry to be able to step in and help us out there.
Okay, so how is your organization helping health systems navigate inflationary pressures and rising costs in healthcare operations?
That's the challenge. Inflation is continuing. I think the market saw a lot of inflation during 2020, and although it's probably not at that same level, I think inflation is something that's not going away in the near future, and we're seeing price increases from OEMs, and we're seeing price increases from a lot of secondary suppliers. I think the ability to have that supplier, that partner that has multiple options and can provide some price sensitivity around those options is an extremely meaningful partner to have. One of the ways specifically that we've taken is providing formulary rules. And a formulary rule for us means if you choose the most expensive option, there's an approval process that's triggered from there. Meaning that there has to be some justification around using the most expensive. That's just one example, but I think again it's important to have that right partner in place. Lastly, one way that we are able to combat inflation on a fairly large scale is through a community purchasing model. So we take the thousands of customers that we represent in the marketplace, and we're able to consolidate that spend together and have a fairly significant approach to third-party companies, OEMs, and carry a large book of business to walk with us also.
Okay, another question that's just come in. How do you manage equipment retirement plans and adequate replacement without affecting the hospital's operations?
So repeat the last part of that for me to make sure I'm understanding the question.
Okay, how do you manage equipment retirement plan and adequate replacement without affecting the hospital operations?
So I think of that as almost like end of life. How are we supporting end of life equipment? And it's really, we're looking at hospital install bases. We're looking at prior data that parts volumes that we've seen from customers in previous history. And we're trying to make sure that those levels are matched with our access to those parts. So we know equipment's going to go end of life. We know equipment's going to get older, but having the ability to maintain access to those parts and having a supply chain that is able to signal the history that we've seen to make sure that, you know, for dash monitors, we have screens available and the knobs available and just items like that, where you see a product that's getting a little bit longer in its product life cycle, however, still very widely used across the country. Just having access to that data, I think, is how we combat that. And then the forward planning of making sure that we have the right quantities in place, the right partners in place to be able to support that.
Okay,
it's a good question.
Okay, before we actually wrap up, is there anything you'd like to summarize with or top tips?
Repeat that if you could, please.
Yeah, before we wrap up, is there anything you'd like to summarize or give any top tips?
No, I think in summary, if you have questions, please reach out to us. We support on some level almost every hospital across the country. We open the opportunity to have more ability to support the teams, the HTM teams, but just grateful to be here, grateful to present our value and share some insights across HTM. Very thankful for this opportunity.
Great. Thank you so much, Mike. We have no more questions, so we'll wrap it up there. So thanks for a great presentation, and I'd like to encourage everyone to visit PartSource website to learn more about the products and services they provide for the industry. So please visit partsource.com. Now, as promised, the answer to today's trivia question is red. So congratulations to our winner, Larry Riley. And just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Now, if you've missed any of our past webinars, including any by PartSource, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. So thank you once again for your time today, and I hope you enjoy the rest of your day.
Thank you.